According to the California Official Voter Information Guide, Proposition 23 establishes new state requirements for kidney dialysis clinics. This is requiring on-site medical professional, meaning that physicians, nurse practitioners, or even physician assistants are to be required on site during all dialysis treatment. In short, Proposition 23 would require the following from dialysis clinics across the states. The first being the presence of at least one licensed physician on site during all dialysis treatment, which actually, if not followed, these clinics can be exempt by the California Department of Public Health. The second being reporting of dialysis-related infection data to both the state and federal government. Lastly, no clinic can actually refuse treatment to a patient and must offer the same level of care to all patients, regardless of whether their treatment was to be paid for by a private insurance or by a government program. This proposition would create new safety regulations for all patients. This could benefit patients of low-income sources who will not be refused treatment based on their payment source. However, this would require a licensed physician, which will cost more money that would possibly lead to less clinics to be open. With that being said, there are some pros to Proposition 23 that could actually be beneficial. According to an article by CaliforniaChoices.org, there will be major improvements to these clinics, such as staff improvements and better regulations. Proposition 23 could actually prevent discrimination on patients' insurance, protecting patients in rural communities. Dialysis is actually a very dangerous procedure, which patients should actually have access to a physician on site where dialysis treatment is being provided. Proposition 23 could be very beneficial. However, there are some cons to this proposition that I would like to inform you about. According to an article written by Paige Austin, many found that these requirements were a bit unnecessary and a bit costly. Clinics would actually be forced to close down, which patients will lose the care that they really depend on. If Proposition 23 were to pass, this would lead to community dialysis to cut service or even close down permanently. This is putting many people's lives at risk who are depending on these clinics and their treatment. Also, Proposition 23 would make physician shortage worse, thus leading to overcrowding in emergency rooms, which many people today feel that dialysis clinics are already strictly regulated and provide high quality care. Proposition 23 could possibly take thousands of doctors away from hospitals and emergency rooms, which making California's doctors shortage worse. The last reason is that some dialysis clinics in the state might have to close due to these increased costs, which many patients would be left with no access to treatment. According to the Legislative Analysis Office, dialysis payments are to be an estimate of roughly $3 billion annually in California. Proposition 23 was planned to meet new state requirements, for kidney dialysis clinics. This could have possibly been beneficial for many patients who needed dialysis treatment. However, this proposition came with its fair share of disadvantages. Now, I would like to ask you, what would your opinion on the new Proposition 23 be?